Hello, Mrs. Cruz. I wanted to thank you again for having this interview with me. The interview should only take about 15 to 20 minutes, and it's just going to be a basic overview on what you do, what compassion means to you, and how you build relationships with your clients. The first question is mainly just an introduction. If you can just tell me your name, your profession, what school you go to, and what experiences you have.
Okay, so my name is Tiffany Cruz. My profession is I'm studying to become a speech language pathologist. I graduated from the University of Texas Pan American in 2014, and I'm currently a graduate student, second year graduate student at UTRGV. What was the other question? The third question?
Where you have your clinical experiences at?
Okay, so I have only, since I'm still a student, I have only had my clinical experiences at the university clinic. We have a speech and hearing center there. So I have had about a year and a half there. Right now, I am doing my clinical externship with ECISD, Edinburgh Consolidated School District. I'm at two elementaries, a high school, and a juvenile detention center. Um, so I don't have much clinical experience yet. I mean, I have a lot with kids, but not a lot with adults. And what I want to specialize in, I believe you said a question like that. I'm still trying to figure out where my passion really lies in regards to the many areas that we have. I would want to potentially work with little kids, the 0 to 3 early developing kids, and either that or to the other extreme end when I do have an adult patient, I would want to focus on adults if that is where my passion lies.
Mhm. So, can you just give me a quick little recap of what your profession entails and what your daily activities might be like?
Okay, so my profession, we help individuals who have communication disorders, which consist of language. They can have language disorders. We also work with voice disorders, swallowing disorders. We work with, there's so many things, fluency. We work with, like I mentioned, language, kids who have our language delayed or disordered. We work with articulation, phonology. Those are basically people who have speech but they can't pronounce some sounds, or they have difficulty pronouncing sounds. So it's it's a lot of areas that we work with. We so we can also work with little kids, like ranging from the neonates at the hospital, neonatals, to adults at the nursing homes, or adults at a hospital, to kids at a, I guess, like at the schools. So we have a variety of settings. We can, as a speech pathologist, you can work with early childhood intervention. We can work with babies at the ICU unit, helping them how to feed them, helping babies how to, especially kids who are born with cleft palates. We help feed them with a bottle. We can work at a school district, and it's also with like the many kids that they have there with special, through the special ed department. We can work at a rehabilitation clinic, like outpatient rehabs. We can work at hospitals, the outpatient hospitals too, like doctors' hospitals at Renaissance. They have a rehab wing, or also just in hospitals working with patients who have swallowing disorders. We do the modified barium swallows. We do X-rays to see if there's a swallowing disorder. Um, just different kinds of things. People who, we also work with people who have, I guess, at a ENT doctor. We can work with people who have voice problems. We rehabilitate their voice. I'm trying to think. There's just so many things you can do. And at a nursing home too, with older patients, we help who have had strokes, TBIs, anything and everything. We do it. So that was that. We said what we focus on.
Wow, that sounds really interesting. It sounds like a very challenging job and a very broad one. What do you think is one of the most important qualities for a speech language pathologist to have, in your personal opinion, of course?
So I can't pick one quality, but I believe there's a couple, or there's a few. For I for instance, I think one of the most important ones, like you said, is empathy. I feel you should be able to understand your client before working with them, because if you don't understand how them and their emotions, then you probably won't be as like I said, understanding in their treatment, and you also have to have patience because some of these people you're habilitating them or rehabilitating them. So you want to be patient, and it takes progress to see improvement. And if you're not patient, then you might want to just give up right away.
Those are very important qualities. Um, what does compassion mean to you in your profession?
Compassion, I think it correlates with empathy. I think compassion means you have to understand the patient. I think there's a few characteristics under compassion. I would say it's understanding your patient, just being your best to help them, um, trying your best to help them, trying to, I guess, help and care for them to the best of your ability. This I guess, yeah, I think that's what it means to me, understanding.
Why is compassion important? What would your profession be like if you had no compassion?
I think compassion is important. Like I said, it correlates with it earlier. You have to understand the patient and what they're going through. You have to care for them. So I think that's why it's really important. Like I said, if you don't understand them, then you won't want to really try your best to help them. Um, this is an irrelevant example, but I I I feel like I have a lot of compassion towards my patients because I want to strive their best to help them. I literally go to the stores on weekends and go to toy stores and buy toys for them or materials, and I want to be the best I can be for them. So, like you said, what would my career be without compassion? I would think it wouldn't. I think compassion wouldn't really. I think it plays a key role in my profession, for example. And I think without it, we wouldn't be able to help the patient the best we could. We wouldn't be able to care for them to the best of our ability. We would just be like an in and out visit. We wouldn't be we wouldn't try hard to make their activities fun or try to make their goals reachable, not believing them. I think it plays a key role.
So, if there were to be no compassion in your profession, do you think your success rate would be as high as it is, or do you think that you would not be successful?
I think you could still become successful somewhat with compassion. I just don't think the success rate would be as high because you can have individuals, who are go-getters, and they will, do the best to reach their goal, but not the patient's need. So I think there still would be success rates, but they wouldn't be as high. I think compassion plays a key role, especially if you want to establish that rapport between patient-client relationship and making therapy fun. That's what it should be about. And if you don't have compassion, I don't think you'll try your best to make it fun or engage the client as much. So,
Okay, those are very good examples. You kind of touched on establishing relationships. So, can you tell me how you go about establishing relationships with your own
uh
clients?
huh. So how would I go? Okay, so for example, when I first get a new patient, I take them in my room or the setting that we're in, and I want to do this thing we do. It's called establishing rapport. So at the beginning, I like to make something fun or something interesting to get to know the patient. So if they're little, I've only had kids. I've only worked with kids, so I try to do like if there's from in the ages from 0 to 3, 0 to 4, even 5, we play games like with cars, bubbles. I love bubbles. We do puzzles, coloring, and I just try to get, it's a thing we do at the beginning, a language sample. So that's like natural communication, and I just try to ask them questions about themselves, trying to get to know them, building that trusting relationship. With adults, it's or older kids, I usually do conversational topics like where do you go to school, how many kids do you have. Um, so yeah, that's how I establish that rapport, and I think it's very important. Like you, that was a question, right?
Yeah, yeah, but that's actually leading to my next question.
Oh,
Why do you think it's important to build the relationship with them, or if you didn't establish that relationship, how would it affect you in your sessions with your clients?
okay. So I think establishing rapport is important or establishing a relationship, because if you don't have that, then there won't be trust, I believe, or the client won't want to work as hard with you. Like, therapy, like I've said before, you have to be patient. So if you don't have that, the client will just maybe their behavior will be off. They won't be motivated. Okay, so it's like if you're working with a stranger. That's what I think. That's how therapy would feel like, and I think
My next question: do you also attempt to establish a relationship with the parents if your client is a child?
yes, because you need to get questions, especially when you have a new client. You need to get questions about the home environment, how the kids communicate at home, how their relationships are with other kids, with their siblings, and sometimes you even ask personal questions such as, has there been I can't remember at the top of my head how we word the questions in the case history, but like, has there been like, I guess, a traumatic change at home that would lead to the client, that would inhibit the client's communication abilities? And I think a parent has to trust you to give you those I guess, answers. So we need to establish like a good relationship from the beginning, so they would be able to, feel like comfortable telling you those things. Or if there's been any change at home, a tragic incident, a death, something like that, I feel if you don't have that relationship with a parent, they won't be able to tell you those things. And also, like, I think with having therapy at one setting, the home setting is different. So you need to establish that relationship with a parent, so in case you want to send over homework or anything else, they will be able to carry over therapy at home.
Okay. What are some of the barriers you face in establishing relationships with your clients and your parents?
With the clients, I would say it's behavioral problems usually, or when they're non-compliant. With kids who are very, very severe, or just who have very difficult attention deficits, that's what I face the most difficulty with. Like, trying to get them engaged, trying to them to perform a task, or when I'm assessing them, especially. I think that's when you're first assessing someone, that's a very difficult, it's a very daunting task because they don't know you and you're a stranger. So with kids who are typically developing, it's normal to do that, establishing rapport and getting a good relationship. But with kids who don't understand or don't know you, that's I think a daunting task. And with parents, I guess challenges would be maybe just um, I haven't had really any barriers with parents. Maybe, I guess, if they don't trust you as a clinician because you're new. Me being a young person, maybe parents won't feel as comfortable with that. So you have to just reassure them that you are trying your best, that you know your stuff. You have to be available to them. I feel that's like a barrier, being young and them being older.
Okay. Well, Mrs. Cruz, thank you so much for taking this time from your busy schedule to have this interview with me, and thank you for all that you do, man.